chaos. While there is optimism on the horizon in the long term, in the here and now, we are still grappling with spikes in everything we measure: the number of cases, hospitalizations, and also deaths. We are quickly approaching 250,000 American deaths, 248,027 to be specific. That's 248,027 empty chairs this holiday season. For the healthy, a stark warning tonight from coast to coast. Officials are urging Americans to consider the dangerous consequences of holiday gatherings. A wedding with 300 guests in Washington state, the latest super spreader event. And tonight, cases are rising in every state. Our Matt Gutman leads us off with the frantic push to slow the surge.
Tonight in hospitals across the country, like this one in Lawton, Oklahoma, they're running out of beds and equipment, but the patients keep coming. How far do you think you are from the breaking point?
Well, we've had a day last week where we were down to one ventilator. We had a day this weekend where we had to pull the ventilator out of an ambulance and put someone on a transport ventilator.
Tonight, more Americans hospitalized than ever with COVID, over 73,000, and the cavalry isn't coming.
Everyone in the whole country is dealing with this, and we have no help. We have no support.
Behind that snarl of tubes, Curtis Sims is fighting for his life. He first felt ill on Halloween. One floor down, we met his wife of 37 years, Suzanne.
His chest will rise, and then he'll get like one little syllable out of there or something. And so you're trying to help him by saying the word for him, and then he gets frustrated if it's not what he wants to say.
And when she dropped him off at the hospital 10 days ago, she realized she might never see him again.
You just go to the parking lot and sit and cry.
With his condition deteriorating, doctors put him on a ventilator 2 nights ago.
So the hospital has started to allow some visitors to visit loved ones. And they told us that they would actually allow you to get into PPE and be able to see your husband, Curtis. If that's okay with you.
Yes, it would be great.
Down the hallway and up the stairs to the ICU, we suited up in full PPE before going inside Curtis's room.
I love you. I can't believe I actually got to come see you.
Tenderly stroking his arm.
You keep fighting. You got this.
We left them alone. This hospital is at over 100% capacity.
The problem is everywhere else is full. So when someone comes in the hospital and they need ICU care, there's nowhere to send them.
What happens if a bus crashes on the interstate and there are a whole bunch of people who need intensive care?
Then you see all these people that are doing the groundwork. They do more. That's all you can do.
This is what keeps you up at night.
I'm not sleeping very well these days.
It's happening everywhere. This nurse in Nebraska, exhausted.
We have, I think they said 10 COVID units, and one of those is just a place for people to go and pass away, unfortunately.
Nurses outside Philadelphia walking off the job today, saying they're not equipped to face this surge. In battered El Paso, where jail inmates are being deployed to load bodies into morgue trucks, nurse Ashley Bartholomew quit when she reached a breaking point. One of her patients comparing COVID to the flu.
You just feel defeated. Am I making a difference anymore? Because I'm here, and here's this patient who's in the ICU and is still clearly confused on how real COVID is.
For some, that reality still not sinking in. But Pfizer did announce today that once they get approval, the vaccine will be available to some Americans within hours, not days. Matt Gutman joins us now from Oklahoma. Matt, talk to us about how hard it was suiting up in that PPE and joining Suzanne as she visited her husband.
You know, it's interesting because for me, it wasn't that hard until I saw something that I don't think anybody has seen before on television or elsewhere, and that is a loved one being able to sit by the bedside of their husband, their spouse, whatever, who is on death's door, fighting for their lives, on a ventilator, struggling for every single breath. So it was once I heard her say to her husband, I love you, don't quit on me, keep fighting. And something you didn't see in that package, Lindsay, is that she told him for the first time that he's having twin grandchildren, a boy and a girl.
Wow.
Obviously, he was comatose and probably not able to assimilate that, but it was definitely one of the most powerful experiences I've had as a journalist in the past 20 years.
Wow, and that's saying a lot. And Matt, you have been crisscrossing the heartland for weeks now, covering this for us. What would you say are some of the common themes that you've noticed as you visit these hard-hit towns?
Over much of the past couple of months, it's been mostly in red states. And the common denominator that we keep finding is people averse to wearing masks. They don't like it. They don't do it. There's no mask mandate in a lot of these states. That is changing. I think there are now only about 13 states that don't have a mask mandate, but that is one of the commonalities that we're seeing. Places are getting hit harder where people refuse to wear masks or where there isn't, a significant amount of compliance. And that's what we're seeing at the hospitals. They are literally begging the people who live in these communities to wear a mask to help them out. They have no extra doctors and nurses. They're at over 100% capacity at this hospital in terms of total beds, ICU beds. You heard what they had to do to jerry-rig a ventilator off the back of an ambulance to make sure that somebody could have it to breathe. They just want fewer people in the hospital, and there is one way that science has established that can help reduce the number of COVID patients in the country, and that is mask wearing. So that is really the major commonality here in every hospital that I've come to you from across the country recently.
Yeah, pretty simple solution there. Wear a mask. Matt Gutman, our thanks to you for tremendous reporting there. And in the middle of this pandemic, many are still forging ahead with holiday plans, trying to make the best of a horrific